Good evening, everybody, and welcome to this Careers in Health and Social Care event. My name is Sarah Ramsey, and I'm Head of School for Health and Social Care and Childcare at City and Islington College. I'd like to introduce some of my colleagues who are with me today. I'd like to introduce Flora, who's the Curriculum Manager for Health and Social Care. Al Hussain, who's here to represent the college for the work experience placement. We've got Neville, who does the same job, work experience placement officer, and we have John with us, who is our careers officer. So each of those people are going to have a little bit to talk to you about this evening, and I'd like to start off with Flora. But before we start with Flora, she's going to introduce the curriculum. There's an opportunity for you using your chat to for a Q&A. If you've got any questions, please feel free to go on to the Q&A tab and type in your questions, and I'll monitor them as we go, and we'll try to answer those as we go along. If there are any questions that we haven't answered by the end of this, we'll contact you directly if you haven't put your questions up anonymously, and we'll answer them for you then. But we'll try to do everything as we go tonight. Over to you, Flora.
Hi, good evening, everyone, and welcome to today's webinar. Yes, the Health and Social Care course is a very popular course with a very strong teaching team and tutors with many years of vocational experience. The course ranges from a level 1 through to level 3. And for the level 3, you would need 4 GCSEs at grade 3 and above, including maths, English, and science is preferred. For the level 2, you would need 4 GCSEs at grade 3 and above, English preferred, with an opportunity for learners to retake maths if they haven't done so well in the GCSEs. And for the level 1, it's quite flexible. It's open for everyone as long as you have a desire to work in health and care and you have a reasonable level of written and spoken English. Yes, for the level 3, the curriculum is quite dense, but it offers a range and a diverse number of units ranging from psychology, biology, research methods, and it gives learners the opportunity to branch into a variety of health and care pathways. And it's very popular, and our progression to university is very good. Similarly, the level 2s is really good, and it prepares learners for the level 3. So in a sense, they do a reduced version of what they would be doing at level 2. So they're well prepared at level 2 to progress on to level 3. And for the level 1, the similar pathway is expected. So a quite smaller scale and contents, and to build them up for level 2. So it's really useful in terms of the learners, the distance traveled and the pathway. So many of our learners start with level 1 and they move on to university. So over to you, Sarah. Any questions I'll be prepared to answer during the course of the webinar.
Thank you, Flora. We have one question. One question here says, if my child does not get the GCSE grades that they wanted for the course that they've applied for, will the college help them to find an alternative course?
Yes. So if the child hasn't got the GCSE grades, depending on the level, so if it's a level 3, let's say they have the English and not the maths, that's something that we could help with. So they could be put on the level 3 course, and they would be supported to retake their GCSE math with us. Yeah, so at level 3, yes, that's what we'll do. At level 2, the same applies. If they the interview stage is a quite useful process. So we don't look at just the academic qualification. We have a conversation. We look at their acumen. We look at their interests. We make an assessment on their personality. Are they caring? Do they really like to work in health and care? And then we take it from there. So yes. And then worst case scenario, we can make a referral to our sister colleges if it's not a good fit for us.
Lovely. Thank you for that, Flora. Hopefully, Diana, that's answered your question. We have a second question just before we move on to Alisane, and that is, do learners need to wear a uniform? And if so, do we need to buy it?
Can you clarify a bit? A uniform where? In college or when they go to work experience?
In college, I think.
No, that's not something that we do at the moment. No, they don't have to wear a uniform.
So it's not the same as school. It's much more flexible, isn't it? And obviously we're looking at learners wearing sector appropriate clothing.
Yes, that's
okay.
Correct.
Thank you very much, Flora. We'll come over now to you, Alisane, to talk about the work experience placements and the opportunities that learners have. And Neville may wish to jump in as well on this one.
Hi, good afternoon. Thanks for coming to this webinar session. My name is Alisane. I'm the Work Experience Officer for Health and Social Care within Camden Road campus. What we've got within our Health and Social Care is a range of employers, but what we've focused on is making sure that we get the big employers within the NHS. So we've got Homerton Hospital on our books. Homerton, of course, is a research hospital in East London. We've got Whittington Hospital, just literally a stone's throw away from a campus, which is about 5 minutes up the road. We've got King's College Hospital, which is one of the biggest teaching research hospitals in the UK. They are fantastic partners. We've got about 60 of our students in with them. Every year we've secured a placement with them, 100 placements with them, which is guaranteed to students from diverse backgrounds from ages of 16, 17, 18 can go in there. They've got expertise, they've got the staff, they've got the range of departments that they can put students into. And our health and social care is purely focusing on students having that experience when they've come into a health and social care course. It's literally for them to understand what it's like in the real world. So what we do with our work placements, we make sure they get real work life experiences within the healthcare sector, which we're very, very focused on. That we want our students to go in there from day one, know what they've gotten into, and have that feel whether they would love to be in that environment and get to know about the good and the bad sides about the environment and everything that they need to know within a health and social care setting. So it's not just about them going to the classroom and being academic, it's them literally going and getting the practical experience as well. And I think the way our courses are run within St. Islington College is simply that there's a 20-25% element of the course itself, which is work experience. So you've got to, for a level 1 student who's a 16-year-old, we insist that they do 92 hours of work placement within a health and social care setting. For level 2, level 3 students, they'll do 100 hours minimum. So if they can do 200, 315 hours, that's fantastic. In what we've done with the piloting of the T levels, we've got something called a CDF program, which is 315 hours, which students can go into and do extra work experience and actually get that real life experience at the workplace. And at the end of that, they'll get a certificate to say they've completed CDF. And what is good for us well is when they're applying to go to universities or apprenticeships, they can use those experiences in their CVs and in their personal statement and say, listen, I've done 315 hours, which is a whole year's work within this sector. I mean, I can say I know a bit more about this sector. So that's what we offer here. I mean, we've got different homes that we work with, Bristol Wakefield, we've got homes in Hackney, we've got Morningside schools, we've got primary schools and secondary schools that we work with. And the schools that we work with for health and social care, we're focused on schools with special needs students. So we're making sure that when our students go into those environments, they're actually doing the care element or the social element of the course itself. So the way the college sees this and the way Capital City Group sees this as a whole is that they get real life experiences plus the academic experience. So when you blend it together, what we have is fantastic students coming out of St. Islington College, Capital City Group colleges, and we're making, I don't know what Neville wants to say, Neville, if you want to add to this. And we love our students and we give them the best here.
That's fine. Thank you very much, Alisane. Just to extend on what Alisane's obviously said about the way that our students at St. Islington College are when they have the opportunity to go in to their work placements is there's also a lot of preparations that's actually taken place in the college prior to that. So we support all of our students to make sure that they have their DBS checks done in the college. We also have worked very closely with our safeguarding team as well. So all of our students from health and social care, they will complete safeguarding modules and also receive certificates for those as well. We also provide them with interview skills as well. So we have different workshops and those are all interactive. We also encourage them to interact with us and communicate with us so they can actually see how they can actually succeed in their placements. In addition to that, we make adjustments to how we provide the information to our students as well. So over the last few years, we've obviously seen that a lot of our 16 to 18-year-olds engage in a lot of social media and different ways of communicating with people. One of our main modes of communication with our students is via Teams. They seem to actually enjoy this form of communication as well. They can communicate with our placement officers on the chat features. What Teams also allow us to do in terms of sharing information about work placement is also share those in the channels as well. And that's really important for us. Really extending, just to conclude on the work placement, because we have such a large database, we also invite a lot of our learners to actually, we also invite a lot of our employers to come down to have careers fairs as well. That allows them to share up-to-date information and for our learners to be up to date and have good practice on our work placement. So that's just a snippet of how we support our learners in work placement for health and social care.
Thank you, Neville. So you can see just by looking at these two gentlemen's faces that they love their job an awful lot. Just to sort of extend a little bit what Neville was talking about with our facilities, we've actually got a realistic working environment here. And for anybody that's been to an open event and been able to walk around and see the facilities, you'll see that in our realistic working environment, we have got a bed, we've got a zone area, which would be a bathroom area with a hoist. We have an area that would be an eating area, perhaps from a care home or a hospital. And we have a real hospital bed with all of the functions that that has, as well as all of the equipment and resources that would be used in these settings. So learners are able to practice a lot of their practical activities before they go into the work placement. So they go in with an element of confidence. The other thing that Neville touched on there was safeguarding. And this year we ran a safeguarding event that was bespokely created for the care sector learners. And this had a two-pronged approach. The first part of it was about how they would keep themselves safe in the workplace. And the second part was about how they would keep a vulnerable person in the workplace safe too. And all learners did that before they went out onto placement. So thank you, Neville. Thank you, Alisane, for that. I'm going to go over now to John, who's going to talk to you about some of the careers that we can go into, and then I'll go into some of the questions. John.
Okay, so yeah, I'm going to say, if that's okay, a little bit about some of the careers that are available from health and social care. I'll also say a little bit about the type of service that we can offer in careers as well, if that's okay. So obviously from health and social care, we have a lot of students who progress into nursing, others go into social work, others apply for occupational therapy. There are some that will go into the care industry. Yeah, I mean, those would be the main areas. There are other health, there are many other health professions, of course, and some of the learners will also be looking at those. The NHS offers a whole range of apprenticeships in some of these areas, like operating technician. There are many of them. So those are just some of the careers. We have really good links with some of the universities that offer courses in those areas. So we organize a whole enrichment program, in fact, as we call it, which includes university visits. We're in the middle of organizing one at the moment to a university locally that has an amazing facility for training nurses and operating theatre technicians. And alongside that, we organise industry talks and specific workshops to help students with personal statements and with university applications. And I guess just to explain a little bit about what we do, so our service, there's two of us here that offer the service. We have industry experience within social care and health, and we can offer individual careers interviews, which offer qualified careers guidance to students, which will enable them to really sort of understand their strengths and what they can aspire to, also aiming to broaden their aspirations, raise their aspirations, and enabling them to plan ahead for what they want to do. We can do those remotely as well, but most of those happen here in college. We also offer tutorial talks, which happen where all of the students will have access to those, which will give them high quality information about the range of careers that are available and about the different options available to them after college, and will then enable them to book in for individual career appointments. We also offer events such as there's in fact there's an HE fair happening at Angel, which some of our students will go to, and there's apprenticeship fairs, those type of events as well. And we can also help with individual help with CVs, personal statements. We provide a lot of individual help for students with those things to make sure that they have the best help they can with their university and job and apprenticeship applications. So that's a bit of a roundup of our service. Happy to answer any questions that may come up.
So we've got a couple of questions here now. So this one perhaps is more for Alusane and Neville. Does my daughter need to find her own work experience place?
Not necessarily, no. What we do, we support, like Neville said, holistically, we prepare them before they go out on placement. We've got a pool of various employers and institutions that will take our students. Well, as a matter of practice, what we would do with our students, we do ask them to go out and look for placements themselves. And the reason why we do that is because we want them to have the experience of going out, speaking to people, having that conversation, having that confidence to do it. But within the college, we've got enough organizations that we are able to post our students to. Now, if it comes to a specific need of a specific student, we've done it before where we find the organization and we make the arrangements that the students go into. So, I mean, Neville could back me up on this. There's more to that.
Just to extend on that as well, then what Alison was saying about tailoring placements to any of the needs of our learners. There was a case study we had last year. I won't mention the particular student's name, but in terms of making adjustments to the learner, we organised transportation from the learner's home to the new setting. We actually managed to get them in a setting that was primarily for students undertaking degrees. And, you know, there was a lot of communication with the directors there that myself and Alison got involved in. Visits up there to the placement of the learner. So as I said, prior to that, making them feel comfortable about interview questions to prepare, giving them an insight to what questions may actually been asked by the panel. And, you know, I think for this individual learner, it's completely tailor-made. So as Alison said, we have a very, very, very big database of employees that we work with at City and Islington College, and regardless of the actual need of the learner, we can cater and support them.
Just to go one more, like what Neville just said, for our students we've had this year within health and social care, at least each student has been provided with 5 placement options. At least each student. This is 5 different institutions within varied sectors. That's how big our database is, and that's how much we can offer our students.
And just to expand on that, what would the requirement be at each level? So would a level 1 learner potentially go into a hospital, or is that does it differ according to the level and the skill development that the learner has?
Well, it's a mixture of everything. the learners will go. I've got a student now who's at Whittington Hospital. She's 16, and they love her so much they don't want her to finish a placement. She's one of those students. She did 12 hours a day on shift. I've never seen it, but she came back to me and said, "I love it so much. I learned so much," and she's 16 years old. So it depends on the institution. So what we do, we look at the learners' needs, we look at the institution that they're going to go into and what the requirements are. Like Homerton will not take anyone below 18. So we know when we've got our polls, we look at the age, dates of birth, we know what students we can send to Homerton. We know what students we can send to Whittington. We know what kind of students will fit into King's or Royal Marsden. It depends. We know who can go into Newham General. We know who can go into guys in the city. So again, we match them based on the distance. So what we try and do with students is we make sure they go to placement within 45 minutes on our at most. And what we do say to them is it's good for them to practice, to move around, leave the comforts of the vicinity of their homes, so at least they can understand that in the real world of work, because that's what we're trying to simulate. It's not just about them going to the institution, it's about them doing all the preparation, traveling, doing the mapping, the zoning, making sure they understand the environment, speaking to new people. So these are all the things that we do, and we make sure they go into the institution. That's how we choose it as well. So it's not just the age, it's on location, it's where they live, what their needs are, and what they're comfortable with.
Thank you. A comment, but not a question here from Pavita, and she says that they looked at another college and the other college were talking about care homes only for work placement. So I guess that's a nice thing to see, that we're extending the aspirations of the learner beyond that.
Oh, most definitely. I mean, we've got very few care home learners, and we've made sure we've pushed them into the NHS, so they can have the multifaceted experience of NHS. You know, within the NHS, it's not just about nurses and doctors. There are sectors within support networks within the NHS that students can go into. And if they want to do a career change, they've got they understand how health works. That's literally what our desire is, that they enter health and social care, they actually understand how health works.
Perfect. So hopefully, Pavita, that's going to help you make a decision as to where your child goes, and hopefully it's going to be City and Islington or one of the Capital City College Group colleges. Couple more questions. I've got one here for Flora. How many days a week will my son come to college?
It could be between 3 to 4 days, depending on the timetabling. So 3 to 4 days. Of the 3 to 4 days, one of the days would be allocated just for work experience. So it all depends on the timetables, and it depends on whether they have to do maths and or English. So no more than 4 days.
Perfect, thank you. And while I've got you, Flora, I'll keep you because I've got another question here that says, will homework be given?
Yes, homework is a key component of teaching and learning activity, and it is good for learners to have homework. It helps them to develop and to get the full breadth and depth of the unit. So that's something that we encourage, and it's an expectation that if you are on our courses, you are required to do homework for each unit. Yeah.
Thank you. And one more for you, Flora. Does the college have the same school holidays as local schools?
Typically, yes. Yeah.
Someone's
I would say
obviously
so. Yeah.
planning ahead there and thinking about their holidays.
Yes.
To book.
Yeah.
And we do try to encourage that you do book your holidays outside of the term time, exactly the same as when you were in school.
Absolutely. Thanks. Yeah.
Thank you. And one now, I think, for Neville. If a student needs to have a DBS, do we pay for that? We, I guess, as in the parent.
No. So all of our students that enroll at City and Islington College, when part of the enrolment process, they would have an opportunity to communicate with our safeguarding team, and our college actually pays for the DBS itself. What we do encourage is that the learners actually apply for the online service. So what that means is, after you receive confirmation of your DBS application within 30 days, if you're able to register for the online service, you'll be required to pay £13. And what that all means is annually, your DBS will be updated automatically.
Thank you, Neville. And the last question that we have at the moment is for John. John, if my child wants to change career choices, would the college support them?
Absolutely, yes. We can obviously help with that. We can advise how that could work, and help your young person look at the different options. Yeah, absolutely. So that is something that happens sometimes. We'd obviously recommend that as part of the process of sort of choosing a course, that young people and parents really have a good sort of research into and get some advice as well about the careers they're looking into before they start their course. And we're available at enrollment days and at open days as well. But inevitably, there are some students where they realize that they do need to sort of think again, and that's absolutely fine. We can help them look into that. And in fact, with the level 3 qualification that students will have from their diploma, they can apply to university for a whole range of courses, not just within health and social care. Obviously, today we're really talking about health and social care, not wanting to take away from that, but the level 3 qualification, you know, obviously assuming they achieve that, and I'm sure most of them will, then they can apply for a whole range of courses beyond the whole health and social care area. And obviously we pride ourselves on being experts on advising on UCAS and how to use the UCAS and university process, and also look at apprenticeships across the board as well. And we're developing more and more links and with apprenticeship providers to enable us to do that. So I hope that answers that.
Thank you very much. There are no more questions to answer, so that just leaves me to round up and say thank you very much for joining us this evening. And you can get in contact via the website if there are any more questions that you have and you'd like us to answer those. Please go on the website and you'll find contact details there to ask any questions. And also just to let you know that we have a taster day coming up in early July. So if you're interested in that, please again take a look at the website and you can see the dates and you can book yourself on. So thank you very much for joining us and we wish you all the very best of luck. Bye-bye.